Hello and welcome to C-Suite Middle East. I'm your host, Shane Phillips, and today we look at the story of Zara Hospital, a brand which was phenomenally strong in Sharjah, but when they first entered the Dubai market, they struggled to find their stride. A new CEO was brought in, Dr. Mohaymen Abdelghany, and today he shares his insights on what he did to drive the organization to peak performance. Dr. Mohaymen, how did you use strategy to turn the hospital around?
Without a strategy, things will not work. And when we looked at strategy, we looked at excelling at the basics. We looked at making sure that the basics are established. So we have certain basics. There is no hospital in the world that wouldn't focus on patient safety, wouldn't focus on quality, wouldn't focus on patient experience. We would also focus on staff and employee satisfaction. But what's the strategy for that? This is the question that makes a big difference here. Once we started, we did a complete market and ecosystem mapping with our external consultants, with our internal teams, with our clinical leaders. The question was to identify the supply-demand gaps and also to identify what can we offer more using that hospital as a facility which is a very, very well-equipped, state-of-the-art. What can we offer for the market? So based on that, the service mix has changed. The revenue lines were streamed, and we started mapping the service, and we started delivering new models of care. So the hospital has changed from a secondary care to a tertiary care hospital. And having a private tertiary care hospital in the region is something unique. So you could access, for example, starting a comprehensive cancer service where you wanted to have advanced surgical cases done for cancer, which were normally sent outside or were normally not tapped here, and the expats return back to their countries to do it. Now, when they find this in Dubai, in the middle of Dubai, they are happy to get these surgeries and procedures done. We started advancing our orthopedic services into advanced sports and advanced orthopedic surgeries. We started advancing our GI, gastrointestinal services. We started tapping into opportunities, aligning and cooperating with external, well-known organizations who are providing these services at a very high level in order to advance our services as well. So the strategy was to move the service mix from a secondary care hospital to a tertiary care hospital, including hiring and onboarding and bringing the doctors and physicians and the surgeons very, very high, and all of them are very well trained to put together a proper service line and start to deliver in the market.
Do you think as we move forward, the market is getting more crowded in the UAE, we're moving into oversupply, will strategy become a much more important narrative?
I cannot agree more with this statement because it's now a very dense competitive market. You can see oversupply of most of the services, yet you can see still an outbound move towards getting healthcare from outside. So there are still gaps in the market, and these gaps need to be addressed by big hospitals, big organizations who are ready to take this load in terms of infrastructure, in terms of clinical teams, in terms of service mix and delivery. And I think that's where the differentiation will come. The differentiation will come if you're able to go the extra mile and do this level of tertiary care services, which is now mostly covered by insurance as well. That's the sustainability put into the place. So you need to tap into this opportunity rather than going into the red ocean. And that's what we did actually. It was a sort of a blue ocean strategy where we focused on those high-end and complex procedures.
Well, thank you so much for sharing your insights and the strategy.
Shane, always. Thank you.